Clinical manifestations of acute radiation syndrome. Acute radiation syndrome begins with the prodromal phase. During this phase, which lasts a few hours to 2 days, the patient exhibits nausea, anorexia, vomiting, headache, malaise, diarrhea, hair loss, petechiae, mucositis, and tachycardia. The initial presentation is the same for all of the subtypes of acute radiation syndrome. This is followed by the latent period, during which the patient is asymptomatic. This lasts for approximately 1 to 2 days. After the latent period, the illness presents specifically for the subtype. For the hematopoietic syndrome, lymphopenia is followed by neutropenia, then thrombocytopenia over a period of 21 days. The patient will exhibit signs of immune system impairment and neutropenia, as well as spontaneous bleeding and coagulopathy associated with thrombocytopenia. If the patient has gastrointestinal syndrome, severe bloody diarrhea is the primary clinical manifestation. If diarrhea is severe enough, the patient may exhibit signs of hemorrhagic shock. Additionally, displacement of bacteria from the gut can result in sepsis and septic shock. In the central nervous system syndrome, this subtype progresses from nausea, vomiting, and lethargy to tremors, convulsions, ataxia, and death within hours to days. Following the period of illness, there is either recovery or death. Death usually occurs within the first 8 weeks after exposure, if it is likely to occur. CNS acute radiation syndrome is always fatal.